Hey everyone, welcome back to this week's episode, and today we're going to do something a little bit different. So on February 14th, 2017, as you can see right here, the American College of Physicians issued a guideline for treatment of non-radicular low back pain. Why is this important? We will discuss that. Who is the ACP, the American College of Physicians, and how does this relate to you? Okay, first, the ACP, if you scroll down, the American College of Physicians is the largest medical specialty organization in the United States, okay? 148,000 internists here. So this is quite a large data of people here who come out with this guideline and tell you what should be acceptable in medicine, okay? Where do guidelines come from? What are guidelines to begin with? Okay, everybody's heard of controlled trials or randomized controlled trials, maybe even meta-analyses. These are among the hierarchy of evidence-based material. But what are guidelines? Okay, guidelines are ways of performing or practicing a medicine or some sort of care based off of the research, if that makes sense. Okay, so the guidelines tell these doctors what to do when treating a patient. It is based off of evidence. Okay, heading down. So the treatment of low back pain. What is supposed to be done now according to this new evidence? Massage, acupuncture, spinal manipulation, Tai Chi, and yoga. Okay, why is that important? Well, that is important because we have an opioid epidemic in the United States. Time again and again and again, what happens is that you go to a doctor, and more often than not, they are prescribed some sort of muscle relaxant, medication, anti-inflammatory, or opioid. And since we have that epidemic, it is spiraling out of control. Okay, if we even read down here, I'm not going to read everything in this article here, but what you see is that physicians should consider opioids as a last treatment for patients who only have failed other therapies. They are associated with harms, risk of addiction, or accidental overdosage. Okay? Heading back up. Okay? So what do the guidelines recommend for your low back pain? Okay? Since it's so darn common, what is going to happen? Okay? Again, also, going back to the pills, acetaminophen was not effective in improving pain outcomes versus the placebo. So guys, if you do have low back pain and you do consult your doctor, typically acetaminophen, Tylenol, opioids are usually not the first case in which you should be tackling this low back pain. What you should be doing, according to these guidelines, again, evidence, is exercise, rehabilitation, acupuncture, mindfulness-based stress reduction, Tai Chi, yoga, another form of rehab, relaxation, biofeedback, low-level laser, CBT or cognitive behavioral therapy, or spinal manipulation. Okay? Physicians should select therapies that have the fewest harms and costs. Okay? That is extraordinarily important. Opioids cost more than most of these therapies, okay? I don't know how much an opioid costs per pill, but I can tell you that you can go on and do home exercise for free, okay? Stress reduction is free. So at the end of the day, the guidelines point to the doctors to tell them what to do. And these things say, hey, do not prescribe opioids as a result of low back pain. The only reason you should be prescribing these opioids is if all other conservative measures have first failed. So what I'm saying is that how does this relate to you really? If you are a person who is suffering low back pain, whether it's severe, mild, or moderate, what I'm saying is if you go to see that medical doctor, or any doctor in particular, and they try to put you on opioids muscle relaxants, anti-inflammatories first, they are more than likely not following the guidelines set out by the American College of Physicians, and they are therefore not practicing evidence-based medicine. So at this point in time, what would I suggest you do? As a chiropractor, I'm not going to just say, go do chiropractic. But what I am going to say is if you need to see a medical doctor, go for it. But find a medical doctor that practices evidence-based medicine, okay? I can't really put it into words other than that, how important that is to have a doc who is actually going to be adherent to the guidelines, because if they're not practicing the guidelines, they're not practicing evidence-based medicine. All right, everyone. I hope this helps you out. If you have any questions, comments, or concerns, you're more than welcome to drop a comment in the link below or the video below. I hope this serves you well, and I'll see you on the next time. Bye.
Don't say nothing,